Hello viewers, this is Dr. Muhammad Abul Hasanat welcoming everyone to my today's lecture. Today, my discussion topic will be about chamber enlargement, hypertrophy and their ECG changes, part 1. So first of all, a few words about hypertrophy and enlargement. Hypertrophy refers to an increase in muscle mass, whereas the enlargement refers to dilatation of a particular chamber. In case of hypertrophy, the wall of the hypertrophied ventricle is thick and powerful, and most of the hypertrophy is caused by pressure overload in which the heart is forced to pump blood against an increased resistance, as seen in patients with systemic hypertension or aortic stenosis. Enlargement refers to the dilatation of the particular chamber. So in case of enlargement, an enlarged ventricle can hold more blood than a normal ventricle. Enlargement is typically caused by volume overload. And enlargement is most often seen with certain valvular diseases. For example, aortic insufficiency may cause left ventricular enlargement, and mitral insufficiency may result in left atrial enlargement. Okay, normally we know P wave represent atrial depolarization. So we look at the P wave to assess atrial enlargement. Similarly, QRS complex represent the ventricular depolarization. So we look at the QRS complex to determine whether there is ventricular hypertrophy or not. When a chamber hypertrophies or enlarges, three things may happen. The ECG wave may increase in duration, the wave may increase in amplitude, or the mean electrical vector or electrical axis of the ECG wave may shift because the hypertrophied or enlarged chamber predominate the electrical axis. So the axis may be shifted to either right side or to the left side. So normally we know the depolarization starts from the pacemaker cell of S node, and S node is present in the right atrium. So the right atrium is depolarized first, followed by depolarization of the left atrium. So the initial half of the P wave is because of right atrial depolarization, and latter half of the P wave is because of the left atrial depolarization. So here you can see the direction of current, depolarizing current during the right atrial depolarization, because the depolarization, the right atrium is depolarized first and then followed by the left atrial depolarization. Okay, and the net vector produced by the both atrial depolarization, that is called the P vector, and it is directed downwards and to the leftward. And if you see carefully, the axis of this net P vector, that is almost parallel to the axis of the lead 2. That is, you know, the position of the lead 2, it is the 60-degree angle. Okay, but the axis of the P wave, it is almost parallel or very close to the axis of the lead 2. And the net axis of this P wave, it lies between the plus 30 degree to plus 75 degree. Okay, so when this axis, when there is a right atrial enlargement, this P wave may rotate clockwise and shift it to the right. So at that case, the voltage in the lead 2, lead 3 and AV, this inferior lead, the voltage of P wave, it will be increased in case of right shift of the P wave axis. But in way, if the left atrium become enlarged, so this axis of the P wave, it will be rotated anti-clockwise. So in that case, the voltage in the inferior leads, it will be decreased, but the voltage will be increased in lead 1 and AVL. Okay, is it clear? Okay, now the next, the normal features of the P wave. The wide or duration in time, it is expressed horizontally. it is 0.10 second or less than 0.12 second. That is equivalent to 2.5 small square or less than 3 small square or 3 small box. Okay, or it is equivalent to less than 120 millisecond. One small square means 40 millisecond. So 3 small square means 120 millisecond. So it should be less than 120 millisecond, the width of the normal P wave. Okay. Now the next feature is height. The normal height, it is equivalent to 2.5 millimeter. That is equal to 2.5 small square, and again or less than the 3 small box or small square. Okay, so whether the P wave is positive or negative, it should not exceed 2.5 millimeter. That is very important. And I have already told you the P wave, the first part of the P wave represent the right atrial depolarization, and the second part or latter half of the P wave is produced by left atrial depolarization. And this P wave is better seen in lead 2 and the lead V1. Why? Because the lead 2 is useful because it is oriented nearly parallel to the P wave axis. I have already shown you the axis of the P wave and the axis of the lead 2, that is almost parallel or very close. Okay. And lead V1 is useful because it is oriented perpendicularly to the axis of the P wave. So the axis of the angle between the P wave axis and the V1 axis, that is almost 90 degree or perpendicular to each other. Okay, therefore, when I have in the very early lecture ECG, I have told you when there is a 90-degree angle lies between the electrical axis of the heart and the lead axis, the wave, there will be a biphasic deflection or biphasic wave will be produced. Okay. Now here you can see the depolarization starts from the SA node, and it first depolarizes the right atrium, and this is the net vector, net P vector produced by atrial depolarizations. And you can see here the direction of this net P vector, it is towards the lead 2 axis. So it is downwards and to the leftward. So it will produce a positive deflection in the ECG paper, especially it will be more prominent in the lead 2 because the direction axis of this P wave and the lead 2 axis, it is almost parallel. So the most prominent wave, it will be produced by lead 2. And here you can see the P wave is a positive deflection is produced by the atrial depolarization, where the first half of this wave, it is contributed by right atrial depolarization, and the latter half of this wave, it is contributed by left atrial depolarization. Is it clear? Now here you can see the position of the V1 lead, and if you see carefully, the axis of the V1 lead, it is perpendicular to the axis of the P wave. So what will happen? The wave that is produced in the V1, it will be biphasic. The initial first half of this wave, it will be positive deflection, okay, due to right atrial depolarization, and followed by, there will be a negative deflection that is caused by left atrial depolarization. So in the V1 lead, the P wave, it is actually biphasic P wave is produced, but it is normal. Is it clear? So P wave is upright in all leads, mainly lead 1, lead 2, and AVF. Okay. And P wave is inverted in AVR because you know the exploring electrode, the AVR, that is situated in the right shoulder. So the direction of P wave, it is completely opposite, or it's moved away from this exploring electrode of the AVR. So AVR produce a inverted P wave. And I have already told you this P wave is biphasic in the V1 lead. So here you can see the height of the P wave. It is less than 3 small square, and the wide of this P wave, it should be less than 3 small box. Okay. Now here's for more detail. This is the biphasic P wave that is produced in the V1 lead, and the first initial positive half of deflection, it represents the right atrial depolarization, and the second negative deflection, that represent the left atrial depolarization. Okay. Now the features of right atrial enlargement. So what happened? What changes would you expect in the ECG in case of right atrial enlargement? So the right atrial enlargement, the amplitude of the first portion of the P wave increases. Okay. Because you know the first portion of the P wave, it is contributed by right atrial depolarization. As the right atrium become hypertrophied or enlarged, so the voltage in the initial half of the P wave, it will be increased. The Y does not change because the terminal component of the P wave, the left atrial in origin, and left atrium remain normal. So duration, it will not be prolonged. Okay. Actually, the right atrial enlargement, in case of right atrial enlargement, the depolarization time of the right atrium, it will be prolonged, but it will be hidden by the normal left atrial depolarization. Okay. Now, the vector of the electrical atrial depolarization may swing rightward, or it will be dominated by the right atrium. The axis may shift rightward, even beyond the plus 90 degree. So the tallest P wave may therefore no longer appear in the lead 2, but in the lead AVF or lead 3. I have already shown you the figure. If it is rotated rightward, so the voltage, it will be diminished in the lead 2, but the gradually voltage, it will be increased in the AVF and the lead 3. Okay. Now here you can see the real picture of the changes in the ECG in case of right atrial enlargement and in case of left atrial enlargement. Okay. So first of, in case of right atrial enlargement, what changes there will be? So if you see the lead 2, I have already told you, due to the right atrial enlargement, the voltage, it will be increased in the initial half. So that will actually increase the height of the P wave. Now this height is more than 2.5 millimeter, or it will exceed the 2.5 small box, or more than 3 small square. So this is the tall T, and this is called P pulmonale. P pulmonale. Okay. Now, what happened in the lead V1? You know, normally this V1 normal wave is, there is a biphasic deflection, but they are equal. But in case of right atrial enlargement, the initial half of this deflection, of this positive deflection, the height, it will be increased more than 1 small box. Normally, the height is maximum 1 small box, but in case of right atrial enlargement, this initial height of this initial half, it will be increased. So more than 1 small box. So that is the changes that is actually you may find in the ECG paper. And I have already told you, in case of right atrial enlargement, the electrical axis, it will be dominated by the right atrium. So axis, the P wave axis, it may shifted to rightward. So you know the normal plus 30 degree to 75, it is the normal axis for P wave. And now it is rotated rightward. So what will happen? The voltage, it will be increased in the AVF and lead 3. Okay, but lead 2, the voltage, it will be decreased. Is it clear? Okay. Now what happened in case of left atrial enlargement? Actually, if you see carefully that if the left atrial enlargement occurs, the duration of the left atrium, because it will be increased. As the left atrial depolarization, it is the terminal event. So due to this left atrial enlargement, the total duration of the atrial depolarization, it will be increased. So normally we know the duration, it is less than 2.5 small square, or less than 120 millisecond. But in case of left atrial enlargement, here you can see this duration is increased. Now it is more than 120 millisecond. 120 millisecond means more than 3 small square. And due to increase the voltage or amplitude of the second half of this P wave, now the appearance of this P wave become bifid or nosed, or like a M pattern. So this pattern of P wave is called P mitrally. It looks like say M. Okay. So that is the very trademark findings of the left atrial enlargement, P mitrally, and it will be produced in the, especially in the lead 2, lead 1, and AVL. Okay, and what will happen in the V1? In the left atria represent the second half of this deflection, that is the negative deflection. But normally the depth of this negative deflection, it is within less than 1 small square. But in case of left atrial enlargement, the depth of this negative wave, it will be increased. Now it is more than 1 small box. Okay, and due to the electrical dominance by the left atrium, the P wave axis, it will be shifted, or it will be rotated anti-clockwise. Okay, and the voltage, it will be increases in the lead 1. Is it clear? But the more prominent features in case of left atrial enlargement, that is the duration of the P wave, it will be increased, and this bifid or M pattern P wave you will find in the lead 1, AVL, okay, lead 2. Is it clear? Now, I have already explained. Now, just for the recapitulation, here you can see the right atrial enlargement is diagnosed by the presence of P wave with an amplitude exceeding 2.5 millimeter in at least one of the inferior leads, either 2, 3, and AVF. Is it clear? That is called the stall P wave. It is known as P pulmonale. And the causes of P pulmonale, that is cor pulmonale, that is COPD, chronic obstructive pulmonary disease, atrial septal defect, tricuspid regurgitation or stenosis, pulmonary hypertension or stenosis, transient P pulmonale occurs in acute pulmonary embolism. All this situation, that will actually increase the pressure load of the right atrium. Okay, and this right atrium become hypertrophied or enlarged, and that will increase the voltage of the P wave, or increase the amplitude of the P wave. And that is why, due to this lung cause, the height of this P wave increase. That is why it is named P pulmonale. So again, here you can see the findings. This is the normal P wave in the lead 2, but when there is a right atrial enlargement, the height of this P wave, it will be increased. Here you can see in the lead 2, the height, it is increased. This is the normal P wave, and this is the P wave produced by enlarged right atrium, that is P pulmonale. And this is the normal P wave. It is seen in the V1 lead. But in case of right atrial enlargement, here you can see the initial half of this P wave height, it is increased, but the latter half, it is normal, remain normal or small, as the left atrial depolarization is normal. Is it clear? Now, in case of left atrial enlargement, the second portion of the P wave may increase in amplitude, and the terminal portion of the P wave should drop, as the terminal portion, that is the second negative deflection in the V1 lead, that represent the left atrial depolarization. So if the left atrium become enlarged, this depth of this negative wave, negative half of this wave in the V1 lead, it will be increased. Okay. So however, the more prominent change in the P wave is an increase in its duration. This occurs because left atrial depolarization represents the terminal portion of the P wave, and prolonged depolarization can be readily seen. But interestingly, with the right atrial enlargement, the prolonged depolarization of the right atrium is hidden by the left atrium portion of the P wave. That is why I have already told you, in case of right atrial enlargement, the duration of total duration of P wave, it will not be altered. But in case of left atrial depolarization, you will find a more prominent change in the duration of the P wave in case of left atrial enlargement. So the diagnosis of the left atrial enlargement therefore also requires that the terminal portion of the P wave should be at least one small block or on a small box that is equivalent to 0.04 second in width, okay, or 40 millisecond. So the electrocardiographic picture of left atrial enlargement has been called P mitrally, because mitral valve disease is a common cause of left atrial enlargement. So here you can see what happens in case of left atrial enlargement. Note the increased amplitude and duration of the terminal left atrial component of the P wave. So here you can see this is the net axis of the P wave. So this is the normal P wave produced in the lead 2, but in case of left atrial enlargement, what will happen? The second half of this P wave, uh, the voltage, it will be increased, and it causes the appearance of the P wave like a bifid or M pattern. This is called P mitrally, and also this duration increases. That is, now it is more, total duration is more than 3 small square, okay, or more than 120 millisecond. So this is the most prominent findings in case of left atrial enlargement. This bifid P wave, P mitrally, and the increased duration of the P wave. Now, the changes occur in the V1 lead. So this is the normal pattern of P wave in the V1. That is the equiphasic deflection. But in case of left atrial enlargement, I have already told you the negativity, the depth of this negative half or latter half of this P wave, it will be increased. And now it is more than the 1 millimeter in depth. Okay. So here you can see the P wave wide, it will be increased more than 0.12 second or more than 2.5 small square, and the appearance will be notched or bifid or M pattern, and it is seen in lead 2, lead 1, and AVF, and in the V1, the biphasic with a prominent deep negative deflection, and that is more than 1 millimeter depth and a small initial positive deflection. Is it clear? So the summary, now the summary of atrial enlargement. To diagnose atrial enlargement, first look at the lead 2 and the V1 lead. Right atrial enlargement is characterized by the following: P wave with an amplitude exceeding 2.5 millimeter in the inferior leads. No change in the duration of the P wave. I have already explained. Okay. The possible right axis deviation due to the electrical dominance by the right atrium. Now, left atrial enlargement is characterized by the following: the amplitude of the terminal negative component of the P wave may be increased and must descend at least 1 millimeter below the isoelectric line in the V1 lead. And the duration of the P wave is increased, and the terminal negative portion of the P wave must be at least one small block or equivalent to 0.04 second or 40 millisecond in white, and there will be the appearance will be notched bifid or M-like P wave in the lead 2, lead 1, and AVL. So thank you very much. That's enough for today. And I will talk about the ECG changes in case of ventricular hypertrophy in my next lecture. Thank you very much.